I want you to imagine that you rush to the emergency room with chest pain and shortness of breath. You know something is wrong, but instead of taking you seriously, the doctor tells you it's just anxiety. Hours later, you collapse and it's fatal. Unfortunately, this wouldn't be an isolated case. This is what happens to women, especially women of color, far too often in our healthcare system. Whether it's your mother, sister, best friend, or even yourself, every one of us knows a woman. So this isn't just about statistics. It's about real people, people that we love, being dismissed and misdiagnosed in moments when they need care the absolute most. After researching this topic through medical studies, news reports, and real patient studies, I found a consistent pattern of neglect and bias. And as a Hispanic woman, I know firsthand what it feels like to have symptoms brushed off and not taken seriously. When I was 32, I started experiencing symptoms that, when told to a doctor, I was just told that it was hormonal and I was just brushed to the side. I still have symptoms to this day that could have been easily prevented if I was just listened to. I'm also not ignorant to the fact that to some, I can come off as white passing. Colorism also heavily influences how poor of treatment and the urgency women receive every single day. I strongly believe that the U.S. Department of Health and Human Services should implement mandatory bias training and oversight policies to address the medical neglect of women, especially those women of color. So let's first explore how serious this problem truly is. Women are being misdiagnosed at alarming rates, and it's costing lives. Black women are 3 to 4 times more likely to die from pregnancy-related causes than white women. According to the CDC, 88%, I want that to stick with everyone, 88% of those deaths are preventable. Serena Williams, one of the greatest athletes of all time, experienced this herself. After giving birth, she felt short of breath and knew something was off, but her medical team dismissed her concerns. She had to insist over and over again on testing, and it turned out she had blood clots that could have killed her. In a 2023 report from KFF Health, researchers found that women and minorities are far more likely to be misdiagnosed than white men. These misdiagnoses can lead to long-term damage or even death. Many women report being told that their physical health symptoms are just stress, or even worse, they're just hormonal, as if this is something we're supposed to experience. This is not just only frustrating, it is absolutely life-threatening. So why does this keep happening? Even to women with money and power and access. The problem just isn't bad luck. It's systemic bias. Implicit bias is when healthcare providers unknowingly let stereotypes influence how they treat their patients. Medical gaslighting happens when patients, especially women, are told their symptoms aren't real or exaggerated. According to Verywell Mind, this happens frequently to women of color who are often described as dramatic or too sensitive in medical settings. The organization called Politics for Her describes this pattern as treating women as invisible bodies, especially when they are Black, brown, disabled, or poor. Even with insurance, education, and advocacy, women of color are still more likely to be ignored or misdiagnosed. But just because the problem is widespread does not mean that it is impossible to fix. There are clear, concrete steps that can improve the system. First, the U.S. Department of Health and Human Services should implement mandatory implicit bias training for all healthcare providers. This training needs to go beyond the one-time course. It should be part of an ongoing professional development. Second, we need greater accountability and oversight in medical institutions. There must be systems to report and investigate bias or neglect care with consequences when needed. Third, medical schools and hospitals must diversify their research and staff so that women's symptoms, especially those unique to Black and Latino women, are understood and studied better. Finally, we must empower our patients. Organizations like Black Mamas Matter or Every Mother Counts helps patients know their rights, ask better questions, and demand care that they deserve. Now let's imagine what happens if we make these changes and what happens if we don't. If we ignore this issue, more women die from preventable conditions. More families will be left without mothers, daughters, and sisters. So the message will remain the same. Your pain doesn't matter. But if we act, women will be believed when they speak up. Life-saving conditions will be caught early, not just brushed to the side. And women of color will finally receive the respect, care, and dignity that they so very much deserve. Today we've talked about how women, and especially women of color, are being dismissed and misdiagnosed. We've seen how bias and gaslighting can fuel the situation and the crisis of this whole experience. And we've discussed realistic solutions to fix this problem through training, oversight, and patient empowerment. No woman should have to beg to be taken seriously. No woman should die because their pain was dismissed. The next time someone you love walks into a hospital, don't let the system silence them. Let's demand a healthcare system that listens, believes, and saves our lives as women. If you want to learn more or you want to get involved, I highly suggest visiting blackmamasmatter.org or everymothercounts.org. Share their resources, ask questions, and during appointments, speak up when someone you care about is ignored, because silence is deadly, but action can save lives. Thank you so much.